Thank you very much for inviting me and for the warm introduction. So let me briefly present some of our related or our work related to COVID, and then I will elaborate on one of them. I'll present them in accordance with disease progression. So at first, as we all know, individuals get exposed to the disease. Then there is an incubation period where symptoms do not appear. And then later on, individuals or a portion of individuals might present some symptoms. A portion of them might decide to get tested, and then a portion of them are hospitalized and even die. And clearly that is the main problem. And our first project deals with the data from hospitals, where we try to predict based on the first day whether an individual will die from COVID. But maybe that is too late. So we thought maybe if we can help a bit earlier. And this is today's topic, where I will elaborate. In this kind of project, what we try to do is to say, given that somebody got tested, will he or she become positive? But also maybe that might be too late. So in the third project, we basically utilized our number one addiction, and that is, you cannot see it here, our phone. And I'm sure you think I'm not a magician, but I can tell you what you did just before you went to bed. You checked your phone. And I can also tell you what you did early in the morning. You checked your phone. We developed a dedicated mobile application where we ask participants to fill in some questions. And the idea is to try to see if we can improve our diagnosis to COVID. But again, that might be too late. For this, we try to utilize data from mobile, not only from mobile phones, but also from wearables. And we equipped 5,000 participants with wearables and the dedicated mobile application in order to see if we can actually identify a digital incubation period before symptoms actually appear in order to curtail transmission. This is just a teaser of a participant. And you can see our anomaly detection algorithm here. The individual presented some symptoms, but our algorithm detected 1 day prior. Now, with the Omicron outbreak, we have 1,200 participants got infected, and hopefully we can improve our models. So, focusing on today's talk, what we can say about all of the related projects and today's talk is that what we try to do is early detection. And we strongly believe that early detection is pivotal to contain the COVID-19 pandemic. And in this specific project that I will elaborate, we try to ask a very simple question. Given that the individual got tested, will he or she is going to come positive? And this work is a joint work with Dr. Erez Shmueli and the KSM Research and Innovation Center at Maccabi. And the motivation from an applicative standpoint is twofold. The first is that only in Israel, we spent billions of dollars just for testing. Our approach can be used for an intelligent pool testing, where we unify large samples of individuals that are unlikely to become positive and unify smaller samples for those that are more likely to be tested positive. Second motivation, and I would argue not less important, is the observation that policymakers worldwide severely affected our basic human rights and sent many, many healthy individuals to house arrest. And that is the non-PC term for self-quarantine. So to achieve our goal, we utilized primary data from the second largest healthcare provider in Israel. This is Maccabi. We have about 140,000 members of Maccabi that were tested between February to October 2020. And these individuals underwent in total 264,000 COVID-19 PCR tests, and 16,000 were come out positive. We developed a machine learning model for COVID-19 detection that utilizes 4 layers of information. The first is the socio-demographic. Now, interestingly, at the time of this study, we identified that men were almost twice as likely to be found positive, arguably because they better protect themselves, or maybe because women tend to test themselves more than men. But regardless of the actual reason, this could be utilized in our prediction task. Likewise, ethnicity, social demographics, they are all associated with some risk to become positive. The second layer that we utilized was the spatial temporal dynamic of the disease. COVID is an infectious disease. It's transmitted via aerosol. So mobility, contacts, visiting patterns, they all can be useful in our prediction task. As a matter of fact, we can learn quite a lot about this pandemic simply for looking at data from mobility. This is just a simple demonstration of what we can learn from the mobility in Israel. This is based on aggregated data of over 3 million individuals, cell phone users. And here what you can see is the decline in their baseline. Okay, this is the good old days before COVID. And this is the lockdown. This is the first lockdown that were observed in Israel. This is another lockdown that were observed. And we could actually see quite a lot about the mobility and infer about it from the dynamics of the disease. And exploring these data more carefully, we even find that the Hebrew term, what we clearly say in Israel quite a lot, Kol Israel Chaverim, that is, all Israelis are friends, is maybe a wishful thinking. So if you like, in Israel, Arabs tend to congregate more with Arabs, and Jewish Orthodox with Jewish Orthodox, and non-Jewish Orthodox with non, and low middle socioeconomic status are more likely to have contacts with low. And by the way, it's well beyond their geographic locations. And poor Arabs, okay, are more likely to congregate with poor Arabs. And I think the message is clear. It's a differential disease, and in some places we can see an increase that might indicate that in other regions that are more likely to visit those specific regions, there is a high risk for infection. And indeed, at least in the beginning of the outbreak, we could clearly say that mobility predicts transmission. This is the R, 12 days after. So we utilize this information and extract relevant features that basically capture what I just presented. The third layer that we utilized was the medical condition and health consumption of an individual. So the medical history of individuals include a treasure, to my standpoint, that is typically left behind. And some health behavior aspect, and even simply behavior aspect, can be identified or inferred by the patient's medical history, and they can be utilized in our prediction task. For example, getting vaccinated with flu, and particularly early in the season, in the flu season, may be linked with some protective behavior. And it was associated indeed with lower chance to come out positive when you're tested. So clearly, psychiatric medications also can provide some benefit in our prediction task, but we decided not to, if you like, dive deep in this data to reduce privacy invasion. Instead, we explored general features that may be associated with health consumption, predictive behavior, and patient's medical history. And let me stress, all of this data is data before the COVID-19 episode or before the testing episode. The fourth layer is the information collected during the testing episode. And interestingly, when we look at diarrhea, for example, in children, it's well known as a symptoms of COVID, particularly in children. However, as children may suffer from diarrhea, they present, or they suffer from diarrhea, but children present with diarrhea were less likely to found positive because they might have diarrhea from other reasons. I will try to be concise here. These are the results, and we could obtain, by integrating all of those four layers, we could obtain an ROC of 81%, which was fairly high given that the gold standard is not that gold. That is a PCR test. And interestingly, just by using the first three layers that were before the testing episode, we could receive almost as good as the four layers. So let me quickly summarize by saying that for future work, what we plan to do is to integrate smartwatches and the data from the smartwatches as the fifth layer. And in a general take-home message, I just want to quickly say that I would argue that from the first day, it was clear that the pandemic affects the population in a differential manner. And we observed unprecedented suffer from the disease. It's not only from the disease itself, but also from the restrictions. And this community can help to try to produce things that are differential in order to reduce the suffer. Thank you very much.
Thank you. Thank you, Dan. Let me ask one question. In the long run, do you think that AI-based early detection may terminate the pandemics or replace vaccines?
Well, I think that to some extent, yes. So if we think about it currently, we don't have a better strategy. So currently, in the current situation, if vaccines are not effective, we will find ourselves in a big problem. And from the early findings from the wearables, we could identify individuals a day before they know that they got the infection. And we do know that individuals may transmit a day prior symptoms onset. So that basically means, and I will be very careful on that, that if we could identify the disease early, at just a day before, then there would be no pandemic. So as time goes by, I believe that artificial intelligence will definitely be, or will take a huge step towards containing pandemics and outbreaks in general.
Okay. Another question came in. We'll just take a few very, very quick answer, please. Have you considered the new early warning system parameters for disease onset and severity prediction?
The new what, sorry?
News. So there's something news that is the new early warning system for disease onset.
Yeah, I'm not aware of it.
Yeah, that's
so.
So the person that asked, please connect to Dan and give some more details.
I'll be happy to.
Yeah.